Well put. And you can have a healthy 70-pound lab that comes in and has tapeworms. Are those tapeworms making that dog sick? No, they're probably not. You don't want them around your house, and you don't want the dog to put up with it. But if you talk about the young, the small, the old, the unhealthy, all these things start to add up. And when you start thinking, my pet, how the heck could it have worms? Well, it happens. A lot of these parasites can live in the soil. They actually live in the soil. So imagine the amount of times you've looked out the window and seen your dog eating grass and dirt and everything that dumb things dogs eat. For instance, whipworms, which we didn't talk about because it's kind of part of the same story, but whipworms, their eggs, a whipworm egg can live through multiple winters and never die.
Okay.
So let's say you have this 100-pound dog that has whipworms. As they're going potty, they're dropping these eggs all over your property. Every winter, they're not dying. All the time your dog goes out and eats grass and sticks and dirt, they just constantly reinfest themselves.
Okay.
So a lot of these parasites become chronic because the whole area is contaminated with this type of egg, particularly whipworms. Now, a lot of the eggs, they freeze in the winter, they die, they're gone.
Okay.
Great. Okay. But whipworms, we see a dog with whipworms, if they've had them a long time, the whole property is contaminated. Those are dogs that need wormed all the time because essentially they're consistently picking them up.
Sure. When you look at the whole worming situation and symptoms and things, what, as a pet owner, should we be watching out for? I mean, every time our dog chews a stick, we're not going to call our vet. I assume it's more the reactive thing of when the worms really manifest themselves. What are we going to be looking for? What should we be looking for?
First of all, sometimes you'll never notice. You'll never notice. The most important thing is when you go to your veterinarian, take a stool sample. They'll check them for them. Sometimes you'll have
Is that like a microscopic look? Is that what you're doing?
Yeah,
okay.
You're essentially a lot of these you'd never see.
Okay.
That's a good point because a lot of people, well, I didn't see any worms in the stool sample. Well, we're not necessarily looking for the adult worm because they don't always come out into the feces.
Okay.
When we examine a stool sample, we're microscopically looking for the eggs of the adult. So we're not finding the adults either. We're looking for microscopic evidence of the adult.
Okay.
So that's how the stool sample, whether you see worms or not, it's a good thing to check because we're looking for the offspring.
Okay.
So a lot of dogs and cats, you'll see no signs. A lot of animals can have vomiting, diarrhea, just kind of look a little rough, maybe eat more and losing weight, and those kind of things. Often you have no idea. You bring a stool sample, oh boy, we find worms. And then we have to worm them before they start causing a problem.
Okay. Is it a one pill solves all problems? I mean, do all of these different worms that we talked about die with the same medicine, or do you have to have different medicine for each one?
That's a very good point. That's why it's best to take a stool sample to your veterinarian because there is no wormer that kills everything.
Okay.
And a lot of times I'll have clients that'll go to some store, get a wormer, say, well, I've given the cat a wormer. Why do I need to check a stool sample? Well, what wormer did you give? Well, I gave wormer X. Okay, well, that kills roundworms.
Okay.
What about the others? So just so you're not giving a lot of unneeded medication, you're better off getting a stool sample checked, which isn't a very expensive endeavor at all.
Okay.
And then the veterinarian can go by weight, what's going to work best, and get the particular medication for that worm. Now, certainly there's medications that get more than one type of worm. But like, for instance, tapeworms, those are hard to kill. Takes a specific medication that's kind of expensive. So you don't want to just randomly treat for tapeworms unless you know they're there.
Sure. Yeah.
So a lot of these things, certainly you can buy a lot of this medication over the counter, but how would you know which one to use unless you've had someone identify what kind of worms you're dealing with?
Right. In reality, you think you're saving money maybe, but in the long run, it's going to cost you more money because you may not be killing the type of worms that your pet has.
Or you're spending too much money on a medication that they don't even need.
Okay. Okay.
So the stool sample's important, the physical exam's important. And again, we're not talking about expensive endeavors here. And again, not to scare people, but if you have children around that are doing what kids do, handling these animals, doing those things, for gosh sake, your pet should not have any parasites.
Right.
Because a lot of those parasites, whether it's fleas, whether it's intestinal worms, they don't care if it's the dog or the child. They can go with either. So that's an important thing. And again, I'm not trying to make it sound like, gosh, the child should not pick up a puppy. They'll get something from it. But it's just something, if you get one of these parasites in your eye, it's not easy to deal with.
Yeah. If you do what you're supposed to do as a pet owner and a parent, you're probably going to be okay.
You're not going to have any problems. Correct.
Now, when we talk about the parasites in our pets, do they primarily hit younger pets or older pets, or does it matter?
Well, I would say it's primarily in younger pets because those are the ones that actually catch them from mom while they're nursing or whatever.
Okay.
But whether you have a 4-year-old dog, a 4-month-old puppy, when you go to your veterinarian, you should check a stool sample. And I'm not saying if you're going once a month for whatever, you need to bring one every time.
Right.
But ideally, you check a stool sample every 6 months.
Okay.
At least once a year. And again, if you think and you watch your dog outside, just watch what they do. And it's not very long till you think, that dog could pick anything up. Because, my dog, for instance, I'll go out and eat grass, sticks, dirt, whatever.
Right.
And if there's parasites there, that's how they're going to pick them up.
Yep. No matter whether you dress them up or not, a dog's a dog.
Correct.
So just watch them, and then you'll be convinced. So we've been talking about the internal parasites, but you mentioned the F word in the veterinary community and fleas. Here we are in October, getting ready to head into November. How are we doing on the fleas?
Oh, it's the same as it is every year. A lot of people think fleas are over because it's fall. This is really probably the worst time of the year for fleas because they're looking for something warm to live through the winter on. So, you look at October, November, even a lot of Decembers are kind of bad, depending, a lot of it's weather dependent.
Right.
But good gosh, don't ever think October ends it.
Okay.
I know November doesn't. We don't have enough cold spells in November to be done with it. And also remember that if you have inside pets, particularly cats, if the fleas are in the house, they don't care if it's 10 below outside.
Yeah.
It's 70 in the house.
Yeah.
So a lot of times it's just safest to treat those pets year round. Same with heartworm. And I don't want to talk too much about heartworm because we always do.
Right.
But depending on weather, that can be a year round issue also.
And when those types of medications first came out, weren't they set up on like a 6-month thing where you gave them then and then don't worry about it? But now the recommendation is year round.
Yeah, and a lot of it depends on where you live. But in our part of the country, now maybe not last winter, which was a
rarity that we haven't
real
had
one.
for a long time.
We had enough warm winters in there where you were seeing transmission of a lot of these diseases year round. A lot of it's weather dependent. Yeah, if someone would have stopped heartworm medicine for 3 months last year, that's hard to argue with. It was a brutal winter. But we don't always have that kind of winter. And when you're talking about something that's $10, $12, $14 a month, it's hard to predict the weather. For me, I never want to flea on my dog. So, first of every month, I don't care how cold it is, I put flea medicine on her.
Yeah.
It's just preventive.
An ounce of prevention is worth a pound of cure. What about ticks? I know deer hunting season is going on, gun season ended November. Deer are on the move and things. Does that generate any more tick concerns than normal?
I will say this. Ticks are hardier than fleas. So we see as much tick issues, certainly in the spring they kind of hatch out. In the summer they die off a little bit, but fall's still a bad time of the year for ticks.
Okay.
They just don't die as easy as fleas do. And so I recommend tick control right up till we get either no winter and you keep doing it, or you get some solid cold weather all the time.
Okay. Well, we've covered a lot of territory here tonight. Jeff's been putting up the information, WoosterAnimalClinic.com. If you have any questions, you can look at the website, or you may call either Mark or Greg or Dr. Mark Haverstock or anybody out at the Wooster Animal Clinic at 330-262-3336. And we should mention that coming up here in the future, in a few weeks, we're coming out to your place. And we're going to tape a few shows. You're going to do some different procedures on some animals. You'll kind of talk us through as you're doing them, and just talk about animal behavior. I think we're talking about separation anxiety and just some really neat things that'll be coming to you from the Wooster Animal Clinic. And we're looking forward to that, and it should be very interesting stuff.
Yeah, we've put some things together where, we can talk about some of these things over and over again, but unless you see it, it's hard to understand what we're talking about. So we're going to put some things together where when you see it, you'll understand what we're doing.
Yeah, we're going to mic you guys. So, if you're like inserting a chip, don't go, uh-oh, that's not good. Things like that. So remember, you're on mic.
We will be ready.
So we'll have some great blackmail money, though.
True.
But you guys never make a mistake out
Never.
there, so
Never.
We're good. But Mark, we appreciate you coming on tonight. Give our best to everybody out there, and we'll
Thank
see
you.
you guys out there in a few weeks, and you folks will see those programs in November and December.
Thanks, Mark.
All right. Stay tuned. More to come tonight on Channel 22, but that will wrap it up for Panorama. Thanks to Jeff Davis, our producer-director. This is Mark Glasgow. Have a good night.